Most people think heart disease strikes out of nowhere. But what if your body has been trying to warn you all along? The truth is, heart disease doesn't happen overnight. Your body sends signals, sometimes in the most unexpected places. Your earlobes, legs, skin, even your eyes. But most people miss them until it's too late. And that's a deadly mistake. Heart disease is the #1 killer worldwide, yet many people never realize they're at risk. What if you could spot the warning signs early and take action before a heart attack or stroke happens? In this video, we're breaking down 7 silent signs that your heart might be in serious trouble. Some of these signs may seem harmless, even normal, but ignoring them could cost you your life. So stay with me until the end, because knowing just one of these signs could make all the difference. And if you recognize multiple in yourself or a loved one, don't wait. Get checked immediately. Let's dive in. Sign number 1, the earlobe warning sign, Frank's sign. What if I told you that a simple crease on your earlobe could reveal hidden heart problems? Sounds crazy, right? But this tiny wrinkle might be a red flag for clogged arteries, and most people have no idea. It's called Frank's sign, and it was first discovered by Dr. Sanders T. Frank in the 1970s. He noticed that patients with a diagonal crease on their earlobes were far more likely to have coronary artery disease, the same condition that leads to heart attacks. Here's what you need to look for: a diagonal crease that runs from the lower earlobe toward your face. It might seem like just another wrinkle, but studies suggest that around 40% of people with heart blockages have this exact crease. Now, does this mean everyone with an earlobe crease has heart disease? Not necessarily. In older adults, it could just be a sign of aging. But if you're under 40 and notice this crease, that's a serious warning. It could mean that cholesterol is already building up in your arteries, putting you at a higher risk for heart problems earlier in life. Why does this happen? Scientists believe that poor circulation and cholesterol buildup don't just affect your arteries, they also weaken connective tissues in the earlobe, causing this visible crease to form. In other words, your body might be giving you a glimpse of what's happening inside your arteries. So if you spot Frank's sign, don't panic, but don't ignore it either. Get your cholesterol levels, blood pressure, and heart health checked as soon as possible. Because sometimes the smallest warning signs are the most important. Sign number 2, hair loss on legs, a circulation red flag. Most people associate hair loss with aging, genetics, or even stress. But what if losing hair on your legs was actually a sign of something much more serious? A warning that your arteries are clogged. This is something doctors don't talk about enough, but it's a major red flag for poor circulation. If you've noticed that the hair on your shins, thighs, or feet is thinning or disappearing, it could be due to peripheral arterial disease, PAD, a condition where the arteries in your legs become narrowed or blocked because of plaque buildup. Here's why this matters. Your hair follicles need oxygen and nutrients to grow, and those nutrients are delivered through your blood. But if the arteries in your legs are clogged, blood struggles to reach the skin, and as a result, hair stops growing. And that's not all. Poor circulation in the legs can also cause shiny, smooth skin on your legs, cold feet and toes even when it's warm, slow-growing toenails or thickened nails, leg pain while walking, also known as claudication. So who's most at risk? If you have diabetes, high cholesterol, high blood pressure, or you smoke, you're much more likely to develop PAD. Smokers in particular are at extreme risk because smoking directly damages blood vessels and makes blockages more likely. The scary part? Many people don't realize they have PAD until it's too late. If left untreated, it can lead to heart attacks, strokes, and even amputation. So, what should you do? If you notice hair loss on your legs, especially if you also have cold feet or leg pain, talk to a doctor. A simple Doppler ultrasound can check the blood flow in your legs and determine if PAD is present. The good news is that lifestyle changes like exercise, a heart-healthy diet, and quitting smoking can help restore circulation and reduce your risk of serious complications. Sign number 3, yellow plaques on eyelids, a hidden cholesterol warning. Have you ever noticed soft, yellowish patches forming on your upper or lower eyelids? Most people think these are just harmless fat deposits or a cosmetic issue, but they could be a serious warning sign of heart disease. This condition is called xanthelasma, and it happens when cholesterol builds up under the skin. It might seem minor, but studies show that over 50% of people who develop xanthelasma have high cholesterol or triglycerides, both of which are major risk factors for heart disease, strokes, and artery blockages. So why does this happen? When your cholesterol levels are too high, the excess doesn't just stay in your arteries, it can leak into the skin, particularly around the eyes. This visible cholesterol buildup could be a mirror of what's happening inside your blood vessels, where fatty deposits are silently narrowing your arteries. Even if your cholesterol test comes back normal, xanthelasma still increases your risk of heart problems. It's often seen in people with high cholesterol or triglycerides, obesity, diabetes, liver disease, a family history of heart disease. If you're under 40 years old and notice these yellow plaques, it's a huge red flag. Younger individuals with xanthelasma have a higher risk of developing early heart disease, even if they feel completely fine. So, what should you do? Don't ignore it. If you notice these patches, get your cholesterol and triglyceride levels checked immediately. Lowering your cholesterol naturally with a heart-healthy diet, exercise, and lifestyle changes can help reduce your risk of heart attacks and strokes. And speaking of your eyes, have you ever seen a gray or white ring around your cornea? You might think it's just aging, but in some cases it's a silent warning that your cholesterol is dangerously high. Sign number 4, grayish or white ring around the cornea. A cholesterol alarm. Ever looked in the mirror and noticed a gray or white ring forming around the colored part of your eye, the cornea? Most people assume it's just a natural part of aging, but in some cases it's a silent warning that your cholesterol is dangerously high. This condition is called arcus senilis, and it happens when cholesterol deposits build up in the cornea. In older adults over 60, it's usually harmless. But if you're under 45, this ring could be an early sign of dangerously high cholesterol and an increased risk of heart disease. Here's why it matters. The same cholesterol that builds up in your eyes could also be accumulating inside your arteries, leading to narrowed blood vessels, high blood pressure, and even heart attacks. If left unchecked, these fatty deposits can silently block blood flow to your heart and brain, putting you at serious risk for heart failure or a stroke. Who should take this seriously? Anyone under 45 who notices this ring, people with a family history of heart disease or strokes, anyone with high cholesterol, obesity, or diabetes. If you spot arcus senilis, don't ignore it. Get your cholesterol and triglycerides checked ASAP. If your levels are high, it's time to make serious changes. Eat a heart-healthy diet rich in fiber and healthy fats. Exercise regularly to boost circulation and lower cholesterol. Avoid smoking and excessive alcohol, both of which worsen artery blockages. Your eyes might be revealing the state of your arteries, and it's better to act before it's too late. Sign number 5, bluish or purple skin, a silent cry for oxygen. Have you ever noticed your lips, fingertips, or toes turning blue or purple? Maybe it happens when you're cold, or maybe it happens even when you're not. While some color changes in the skin are normal, persistent or unexplained blueness, a condition called cyanosis, could be a serious warning that your body isn't getting enough oxygenated blood. And that's a problem. Your heart is responsible for pumping oxygen-rich blood throughout your body. But when your heart is weak or your arteries are blocked, it struggles to circulate blood efficiently. The result? Certain areas, especially those farthest from the heart, don't get enough oxygen, causing the skin to take on a bluish or purplish tint. What's happening inside your body? Cyanosis can be caused by several serious heart and circulation problems, including blocked arteries, which reduce blood flow, heart failure, where the heart isn't pumping efficiently, lung diseases like COPD or pneumonia, which lower oxygen levels, blood clotting issues, which can restrict circulation. Who should be concerned? If you notice bluish or purple skin that doesn't go away, especially when you're warm, it's time to take action. This could be a sign of an underlying heart condition, poor circulation, or even low oxygen levels in the blood. Other symptoms that often appear alongside cyanosis include shortness of breath, chest pain or discomfort, extreme fatigue, dizziness or lightheadedness. What should you do? If you experience frequent cyanosis, don't ignore it. See a doctor immediately. A simple oxygen level test, heart function test, or circulation exam can help determine if your heart is struggling. In the meantime, improving heart health through regular exercise, a nutritious diet, and quitting smoking can help your body get the oxygen it needs before things get worse. Sign number 6, Sores on legs that won't heal. A dangerous sign of blocked arteries. A small cut or wound should heal on its own, right? But what if you have sores on your legs, feet, or toes that just won't go away? This isn't just a skin issue. It's a major red flag that your circulation is in serious trouble. These wounds, known as arterial ulcers, happen when your arteries are so clogged with fatty deposits that blood can't reach your skin to help it heal. And here's the terrifying part. This is a late-stage warning sign of peripheral arterial disease, PAD, meaning your heart and brain might not be getting enough blood either. In other words, your legs could be warning you about an impending heart attack or stroke. How do you know if it's an arterial ulcer? Sores that take weeks or months to heal, or never heal at all. Cold, painful, or numb feet and toes. Shiny, thin skin around the wound. A deep, punched-out appearance. Who's most at risk? These slow-healing sores are most common in people with diabetes, which damages nerves and circulation. High cholesterol and high blood pressure, which block arteries. A history of smoking, which severely damages blood vessels. Many people with diabetes or nerve damage, neuropathy, may not even feel pain from these ulcers, making them extremely dangerous. Left untreated, they can lead to serious infections, gangrene, and even amputation. What should you do? If you have a sore that won't heal, don't wait. Get checked immediately. A simple Doppler ultrasound or an ankle brachial index ABI test can determine whether your blood flow is restricted. The good news? If caught early, lifestyle changes like exercise, a heart-healthy diet, and quitting smoking can help restore circulation and prevent complications. But ignoring it? That's not an option. Sign number 7, swelling in legs, ankles, and feet. A hidden sign of heart failure. Ever noticed your legs, ankles, or feet swelling up, especially by the end of the day? Maybe your shoes feel tight, or pressing on your skin leaves a deep indentation that takes a few seconds to disappear. Most people brush this off as harmless water retention, but in reality, it could be a major warning sign that your heart is struggling to pump blood properly. Why does this happen? When your heart weakens or fails to pump efficiently, blood starts pooling in the lower parts of your body due to gravity. This leads to fluid buildup, also known as edema. And here's where it gets dangerous. Swelling in the legs is a classic sign of congestive heart failure. If your heart can't keep up with your body's demands, fluid leaks into surrounding tissues, causing persistent swelling that gets worse over time. How do you know if your swelling is a heart issue? Swelling that gets worse by evening or after sitting for long periods. Skin that feels tight, stretched, or pitted leaves an indentation when pressed. Shortness of breath, fatigue, or rapid weight gain. Swelling in both legs at the same time, not just one. Who should take this seriously? If you experience swelling alongside other heart-related symptoms, like shortness of breath, dizziness, or fatigue, this isn't just a circulation issue. It's a sign your heart is struggling and needs immediate medical attention. Swelling can also be linked to high blood pressure, which overworks the heart, kidney or liver disease, which affects fluid balance, deep vein thrombosis, DVT, a dangerous blood clot in the leg. What should you do? If your swelling is persistent, getting worse, or paired with other symptoms, don't ignore it. See a doctor immediately. A heart function test, echocardiogram, blood tests, or a circulation check can reveal if your heart is the cause. To reduce swelling and protect your heart, try reducing salt intake, since salt causes water retention, elevating your legs when sitting or sleeping, exercising regularly to improve circulation, managing underlying conditions like high blood pressure or diabetes. Now, I have a question for you. Have you noticed any of these symptoms in yourself or someone you know? Let me know in the comments. If you found this video helpful or eye-opening, don't keep it to yourself. Hit that like button, subscribe, and share it with someone who needs to see this. You never know whose life you might save. Your heart works 24/7 to keep you alive. Take care of it before it's too late. See you in next video.